Hello and welcome to another day of Q&A with Dr. Karishma. Of late, I've been having a lot of patients complaining of headache. Their headache is predominantly in the strip just above the eyebrows and often associated with eye ache or heaviness of the eyelids and a feeling of tiredness in the eyes. So most of them call me up or come to me saying that, Doctor, I'm worried that my number must have changed. It must have increased. Now, here are your tips to figure out why you are getting a headache while you may be stuck in this lockdown. Point number 1. When was the last time that you had your numbers checked? Because if your numbers were checked in the past 6 months even, or even in the past few months, it's unlikely that they're going to increase suddenly without any rhyme or reason. So don't let this affect you. The lockdown is causing a lot of stress and anxiety in a lot of us. You are not alone. We are in this together. But that is not going to produce a sudden change in your numbers. So don't let that confuse you or worry you. If you've even had your number tested in the past 1 year, unless you are a young child in whom the number may have jumped significantly, and in them, yes, they may experience headaches and eye ache very easily. For adults, we don't really expect your numbers to jump very significantly. So even if your number has changed by say a 0.5 or a 0.75 even, whether it's a plus or a minus, it's not really going to cause a significant headache all of a sudden. So don't be too worried. So the first thing that you need to think of is think about when you last got your numbers checked. Now, point number 2, what kind of a headache is it? Is it only localized to the area around your eyes? Is it associated with a lot of burning and heaviness and tiredness of the eyes themselves? Because that could be dry eyes. Number 1, related to the season change. We're entering the hot summer season. And number 2, the constant digital strain. Whether or not we are working from home, our mobile phones and our laptops are our current go-to for everything. We are all hooked on to the mobile phone, whether it's for watching videos, for playing games, for homeschooling, or your laptops for working from home. Now, it's quite possible that your eyes are having an overdose of these digital devices and thus adding to the already existing dry eyes which is happening because of the weather. Now, this could be simply treated with some moisturizing eye drops. Don't try to self-prescribe them. Get in touch with an eye doctor before you can use them. If you already have them or you already know that you are a patient of dry eyes, then feel free to use your moisturizing or lubricating eye drops as often as possible. But more than that is tip number 2. Make sure that you get a day of digital detox. So put aside your mobile phone, use the weekend, use the Sunday that's coming up tomorrow to keep your phones aside and not look at them, so that your eyes also get the much required rest that they need. So that was point number 2. First, we already discussed was when did you last have your number checkup? Second is, are you having an overdose of digital devices? Point number 3 is, are you hydrated enough? Because if you've not been having enough water, in general, just the dehydration of your body itself may manifest with a headache. So make sure that you're drinking your water adequately and frequently. And last but not the least, point number 4 is, are you sleeping well? Because of this lockdown, like I mentioned earlier, there's a lot of anxiety and a lot of stress. Even though you may not be speaking about it, you may be thinking about it. We're constantly reading it in the newspaper. We're constantly worried about when is the next extension of the lockdown going to happen. It's constantly on our mind. And of course, at some point, it is affecting us whether you realize it or you don't. So if you do think that you're constantly thinking about the lockdown, the virus, and you're constantly reading to be constantly updated about what's happening in the outside world, take a break. Spend some time with your family. Do something that makes you happy. If you need to take a break from your daily chores, do that. Give yourself that much required break so that you can stop this anxiety, get a little de-stressed, and automatically your headache might just resolve on itself. So If you have thought about these 4 tips and found the answer to your headache, you might be just able to help yourself before you decide to pop some medications without any reason. So unless and until you have thought of these 4 tips and they've not helped you at all and you think that the headache is going out of hand, that's when you might want to bring in the medication. If, of course, you are a known patient of migraine who's regularly on medications, then these tips might apply to you to a certain extent, but of course, you need to continue your medications without fail. I hope you all are staying safe. Take care and we'll see you soon.